Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
So retina is a major part of the eye. That's why it has so many diseases also. There is no one disease that can affect retina. Like optic nerve, the main disease is the glaucoma. For lens, the main disease is cataract only. But in retina, there are n number of diseases. We cannot discuss every disease, but the most common diseases are first, diabetic retinopathy. So any patient who is diabetes, and if the blood sugar is not controlled, or the patient is having diabetes for a very long duration, like 10 years, 15 years, that patient is ultimately going to get diabetic retinopathy if the control is not very good. First thing. And second, very common disease nowadays is age-related macular degeneration. Because the life expectancy in India is increasing. Now people live for 80 years, 90 years. Before, this disease was very common in the Western world, where the people live around 100 years. So mostly patients after 70 usually get age-related macular degeneration, in which the center of the eye by which you see becomes weak, and sometimes swelling also develops in that part. So that is called age-related macular degeneration. So these are the two very common diseases. And there are other diseases like retinal detachment and holes in the retina, and there are so many diseases. So the most common, we should focus on diabetic retinopathy. That's a totally your lifestyle thing. If you have diabetes, you will develop this disease. And the second thing is age-related degeneration. So both the diseases are mostly happen in the old age patient. So again, if anybody has a diabetes or on treatment of diabetes, that person should get the retina checkup every 6 months by the retina specialist. One thing. Regarding the age-related macular degeneration patient, they should visit their doctor every year. And if they notice sudden decrease in vision, they should visit early. Okay, so in age-related degeneration, most of the time, it is nicely cured with the help of injections in the eye, which reduces the swelling in the eye and patients get good vision back. But mostly these injections are multiple. Patient need to get multiple injections to cure this disease.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
So for retinal health, there are some foods that works very well, that helps a lot in good retinal health, like yellow fruits. If someone is eating yellow fruits regularly, chances of retinal degeneration goes down. Okay, if you eat leafy vegetables like spinach, carrots, and all these things, if you eat all these things, the risk of degeneration again goes down. So for degeneration, these two things are yellow fruits, leafy vegetables. And for diabetic retinopathy, again, you have to control your blood sugar, eat healthy, do exercises. These things works very well. And nowadays there are some medications, some antioxidants that helps to prevent the degeneration of retina with age. So you have to consult your doctor, ask him if you need any antioxidant for yourself or not. If doctor suggests that you should eat antioxidant on and off, it's better to start on antioxidant, especially in older patients.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
So one of the, you can say the pandemic nowadays or in this last 10 years is myopia. So myopia means glasses number. So almost every second kid has a glass number. Okay, so you have seen in the society that everybody is using glasses because in the last 10 years, the usage of computers has increased. People are not going out, they're on computer or either on mobile or on books. They're not playing in the ground. So this has caused increase in the myopia. So more and more people are getting glasses. So to avoid myopia or to avoid the progression of myopia, the kids should go out, should play out at least 1 or 2 hours every day in a park or in a ground to avoid the progression of myopia. If you are having myopia, it's always better to use glasses. Because of the cosmetic reasons, many people are not using glasses, or because of some family concerns, they're not using glasses. So it's always better to use glasses. Avoid lesser work on computers. Like in children, they use unnecessary mobile or computers without any issues. Like adults, they have to work on computer. They have to work. They cannot avoid computer. But in children, they don't have any specific or any compulsory work on computer, but still they are on computer. So at least in the growing age, for example, in between 5 years to 18 years of age, in this age group, they should avoid excessive computer mobile, because this is a growing age. If you use a lot of computer, a lot of mobile in this age group, ultimately you are going to get myopia or glasses prescription. So avoid computer mobile, use less, and play more outdoor games. Don't indulge yourself in the indoor games. Play outdoor games. So that is good for your health, and in this way you can prevent myopia in the society.
So doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative, and we believe your participation will greatly benefit the patients.